Today, we introduce you to our very first pair of nonprofit leaders of the year. What is the culture that you've developed at Lamprey Healthcare? What are the things that are keeping your folks engaged?
I would say we're very mission focused to a T. I think the folks that work with us are there for a reason. Sue and I would say, have a very unified view and support of our mission of the organization and why we're here and why we do this work. And I think it's important for us when we recruit staff to bring them in that they share that sort of value that, we understand people work because it's a job, but, how do you feel about doing your job every day knowing, I'm here to help people in terms of folks that perhaps didn't have as many opportunities to access care.
Our staff is really fabulous when we have new ideas or new initiatives. It's really great to see the enthusiasm as long as it can be connected to patient care. There's a lot of connection to the mission to taking care of patients, and you see it every day. You see it talked about in huddles, you hear about it in conversations. It's not an abstract thing. People are truly living out our mission. We are so lucky to have a multidisciplinary team that has a voice in the care of the patient.
How did that first come about, the idea to have a co-CEO roles? And how do you divide up the role amongst the two of you?
I felt at the time that we needed to do something different, and Sue had been integral in so many projects, and I felt she was somebody I thought I should partner with. And I think we set about to propose a co-CEO model because, getting things done was important and getting them done well. And I think our skill sets and our experiences complemented each other.
It is a very unique model. And Greg comes from more of a finance realm, and I'm a registered nurse, and I have been more focused on program development. And, it kind of allowed us to kind of create the whole picture because one person is not going to have extensive skills and experience in all realms of leadership. There's a lot of similarities, but there's still differences in how we might initially see a situation. And being able to talk through that is really fantastic and creates better decisions, quite frankly.
We didn't necessarily start out with this is your lane, this is my lane, and we're going to stay there. I think, as Sue mentioned, there's an opportunity ongoing for us to kind of meld over into different areas, and we have a common set of goals. And I think that has proven out over the three and a half years we've been at this, and that, the organization has been successful. And I think that's really the proof.
Greg and I both have an open door policy, and we are present at each of our locations throughout the week. So I think it's really important, whenever there's a big change like that, to continue to take the pulse of how people are feeling and be very open to questions and very transparent about this is our plan and we think it's going to be successful. And I think as people kept seeing these successful initiatives, it just was more reinforcement like this model's working.
Can you talk, each of you, about what you respect most about your co-CEO?
I have to say, Sue has a very high standard and a very high ethic in terms of her investment in our mission, and I certainly respect that tremendously.
Greg has a very deep level of expertise in terms of finances and a lot of history in terms of, predicting trends. Greg very clearly cares about the mission, cares about the people who work at Lamprey, and his way of working it's very calm, and it's, very much like trying to understand the other side.
The other thing that's very apparent in talking to you is that you have a real passion for your mission, for your people, for your patients. Can you each talk about what Lamprey Healthcare means to you?
I place a very high value on community. So when I see board members and volunteers and patients, all working towards a common best outcome for their community, there's nothing better than hearing the stories of how your services have helped someone.
I think there's no denying we are in a very broken healthcare system right now. And in my mind, Lamprey Healthcare is a model that works. It focuses on building relationships, building trust, and helping people move forward in their lives. It's my life's work. I mean, I cannot imagine feeling burned out from it or wanting to go in a different sector.
Congratulations on winning the Nonprofit Leader of the Year award. I'm so glad that all of your hard work is being seen. You totally deserve it.
Congratulations, Greg and Sue, on being named Nonprofit Leaders by Business New Hampshire. Together, you have led Lamprey Healthcare to provide the kind of comprehensive services that other providers may aspire to.
Congratulations to Sue and Greg on being named co-CEOs of the Year, New Hampshire. That's just fantastic news, well deserved, and certainly a testament to the care and the commitment you have to your community. So well done.
Hey Greg, having known you for the better part of 4 decades and seeing the time, the effort, the dedication you've put in supporting nonprofits, I can't think of a better person to receive this award. Congratulations.
Sue and Greg, congratulations and my sincere thanks for your commitment, compassion, and dedication to uphold the mission of Lamprey Healthcare to provide high-quality, comprehensive healthcare and access to coordinated services for all individuals regardless of ability to pay.
As co-CEOs, your shared vision and leadership have taken Lamprey Healthcare to new heights. Congratulations for all you've accomplished and continue to make possible for Lamprey's patients, staff, and communities across New Hampshire.
Sue, congratulations. I'm not surprised somebody so compassionate and talented and smart and hardworking as you, of course. You won this awesome award.
Hey, Sue and Greg, congratulations on the award. Well deserved. We're so proud of you.
Yes, so very proud of you. Well deserved on the award. Not surprised. Keep up the good work.
Congratulations, Sue. As Tina Turner says, you are simply the best. This award is just another example of the amazing work that you continue to do, you've done for so many years. So proud to be your friends.
Congratulations, Mom, on the New Hampshire Nonprofit Leaders Award. I'm so proud of you, and I'm always in awe of your dedication to serving others. Huge congratulations to both you and Greg. Enjoy the celebration.
Hey Mom, congratulations on the award. No one deserves it more than you, and I love you so much.
Congratulations, Greg and Sue, on being named the 2026 Business New Hampshire Nonprofit Leader of the Year. This is a recognition of your commitment to the communities you serve. Congratulations.
Congratulations, Sue, on winning co-CEO of the Year for nonprofits in New Hampshire. You're an amazing leader, an amazing person, and just so proud of you for all the work you do for our communities.
Hey Dad, congratulations on being recognized as a Nonprofit Leader of the Year. The work you do for your staff and the community makes a real difference, and I'm really proud of you for everything you've accomplished. You've worked incredibly hard for this, and it's awesome to see you getting recognition. Love you. Congratulations again.
Hi, I'm Priscilla Stewart. I'm Sue Durkin's mom from Virginia. I'd like to congratulate Greg and Sue for the great work they've done and the award they have received, acknowledging all their dedication and the time they have put in. Congratulations.
Congratulations, Sue